Clinical questions on muscarinic agonist, M3 receptor. 1. A patient is given a muscarinic agonist that selectively stimulates M3 receptors. Which of the following effects is most likely? A. Bronchodilation. B. Dry mouth. C. Bladder contraction. D. Increased heart rate. Answer C. Bladder contraction. M3 receptors are found in smooth muscles, bladder, GI tract, bronchi, glands, and the eye. Activation of M3 in the bladder causes detrusor muscle contraction, leading to urination. 2. A 60-year-old man with chronic obstructive pulmonary disease, COPD, is prescribed a muscarinic antagonist. Which receptor is being blocked to improve his symptoms? A. M1, B. M2, C. M3, D. M5. Explanation. M3 activation causes bronchoconstriction and increased mucus secretion. Blocking M3, e.g. with ipratropium or tiotropium, leads to bronchodilation, improving airflow. 3. A patient presents with excessive sweating due to overactivation of M3 receptors. Which of the following drugs would help? A. Pilocarpine. B. Atropine. C. Acetylcholine. D. Bethanechol. Answer B. Atropine. Explanation. M3 activation increases sweating via sympathetic cholinergic fibers. Atropine, a muscarinic antagonist, blocks M3, reducing excessive sweating, hyperhidrosis. 4. A 40-year-old woman with glaucoma is prescribed a muscarinic agonist. How does this drug reduce intraocular pressure? A. Relaxing the ciliary muscle. B. Constricting the pupil, miosis. C. Increasing lens accommodation. D. Reducing aqueous humor production. Answer B. Constricting the pupil. Explanation. M3 activation contracts the pupillary sphincter muscle, leading to miosis, which improves drainage of aqueous humor through the trabecular meshwork, lowering intraocular pressure. 5. A patient with xerostomia, dry mouth, is prescribed a muscarinic agonist. Which receptor is responsible for increasing saliva production? A. M1, B. 2, C. M3, D. M4. Answer. Explanation. M3 receptors stimulate exocrine gland secretion, including saliva production. Pilocarpine, a muscarinic agonist, is used to treat dry mouth, xerostomia. 6. A patient with urinary retention is given a muscarinic agonist to stimulate urination. Which of the following drugs is most appropriate? A. Atropine. B. Tiotropium. C. Bethanechol. D. Scopolamine. Answer C. Explanation. Bethanechol is an M3 agonist that stimulates bladder contraction, detrusor muscle, improving urination in cases of urinary retention. 7. A child presents with bradycardia, excessive salivation, and bronchospasm after ingestion of an unknown substance. Which of the following toxins is most likely responsible? A. Organophosphate poisoning. B. Anticholinergic overdose. C. Beta blocker overdose. D. Opioid overdose. Answer. A. Organophosphate explanation. Organophosphates inhibit acetylcholinesterase, causing excessive M3 activation, leading to sludge symptoms, salivation, lacrimation, urination, diarrhea, GI distress, emesis, and bronchospasm. 8. A 55-year-old man with overactive bladder is prescribed oxybutynin. Which receptor does this drug block? A. M1, B. M2, C. M3, nicotinic. Explanation. M3 activation contracts the bladder. Oxybutynin is an M3 antagonist that relaxes the detrusor muscle, reducing urinary urgency in overactive bladder. 9. A patient presents with pinpoint pupils, wheezing, diarrhea, and excessive urination after exposure to a pesticide. Which treatment should be given immediately? A. Beta blockers. B. Atropine. C. Pilocarpine. D. Propranolol. Answer B. Atropine. Explanation. The patient has organophosphate poisoning, M3 overactivation. Atropine, a muscarinic antagonist, blocks excessive parasympathetic activity. 10. A patient taking pilocarpine complains of blurry vision when reading. What is the most likely cause? A. Pupil dilation. B. Ciliary muscle contraction. C. Decreased lens accommodation. D. Increased intraocular pressure. Answer B. Ciliary muscle contraction. Explanation. M3 activation contracts the ciliary muscle, increasing lens curvature for near vision accommodation. Excess stimulation can cause blurry vision due to difficulty adjusting focus. Key takeaways for medical revalidation of Puerto Rico. M3 receptors control smooth muscle contraction, bladder, GI tract, bronchi, gland secretion, and pupil constriction. M3 activation, bronchoconstriction, salivation, sweating, urination, and GI motility. M3 antagonists, e.g., ipratropium, oxybutynin, atropine, treat asthma, overactive bladder, and excessive sweating. Organophosphate poisoning causes excessive M3 activation and requires atropine as an antidote. Would you like more detailed clinical case?